say it's interesting. It's you see this group of people that are incredibly different from each other, and yet they all say that, you know, maybe these 2 or 3 things are very important to them, and then you see them running after it with everything they've got, and pursuing it very intentionally with their time and their resources and their money and their practice, and everything kind of builds after that. And it really is amazing to see when you say, okay, if I care about this and I say this is important to me, then this is what it looks like to do this well. And it really is inspirational. You don't see that a lot. And to see all of them do it and somewhat differently, because they don't all do it the same, but I mean, I would say they all hold these certain ideals very high, and then prioritize them day after day. Not just like a certain time of the year or occasionally or partway, but really do get after it. And that's why they're awesome at it. But so if I parse it apart, probably the things I do the most now are kid hand surgery, nerves, and then big tumor trauma reconstruction. And all of that was part of my hand fellowship. And part of that, there are other things I'd love to be in my practice now, but they're just not right now. They've kind of been slower to build, or they're going to be long game decisions, or people are already doing them, so it's a bit harder to break into. And I'm fine with that. These things, I love these 3 things that I get to do, but all of them were a huge, probably part of me loving them was getting a lot of exposure to them and learning a lot about them and feeling very confident in them. And that was St. Louis absolutely built on top of my residency program, and then was a great launching pad for kind of even more higher level learning, and then being able to figure out, okay, how does all this come back together? Okay, it's like, I can do this, I want to do this, I feel compelled to do this, and all of these beautiful things coming together that make you just feel like, yeah, okay, this is what I want to be doing, and this is meaningful and worthwhile, and it feels like a job well done at the end of the day. And my training in St. Louis absolutely set me up for that. I'm really thankful for it.
I think it's certainly in terms of the practice, so many highlights. Practice speaks to your knowledge base. I feel like fellowship was just incredibly well-rounded in terms of covering every niche and subspecialty area of hand and upper extremity surgery. Certainly, as far as I was concerned, practice efficiency. We've touched on that through different providers. I think. Patterns of patient care and patterns of patient excellence, certainly that comes to mind again across a breadth of the leaders. Certainly Dr. Calfee has been our case in point here tonight. The leadership and academics at Washu are second to none, and I think they're at least for my impression thus far, I don't know frankly what you think, but almost impossible to replicate. I mean, and again, I'd like to think it has everything to do with resources, but it probably has some to do with that, and probably much more to have about the people that are, again, the driving force behind the productivity in the research and academics. But certainly there, the collective the faculty body that represents the 7 academic hand surgeons are a model for academic integrity and academic excellence, academic productivity. That certainly is something to be chased and is highly impressive and desirable. And they remain resources, in an ongoing sense, like I said, including opportunities to get into next level societal commitments and committees and such. I think again they've been highly instrumental in my capacity to do that. So that's certainly very much appreciated.
Yeah, I mean, I think basically it's for me what the first question you asked, which is what makes Washu special, and that it really was just such a foundation for starting practice. I mean, I think walking in with kind of the confidence that you can take care of most things, but still be, humble enough to know that there's going to be a lot you have to learn. I mean, that was all just from being at Washu, and just, there was nothing, I just went in on day one being like, okay, I've seen most of this stuff before. And, you know, if I didn't see it exactly, I saw enough of something similar that I can kind of, you know, figure it out. And we just were exposed, you're just exposed to so much. I mean, there's just such a breadth of practice. And even in private practice, which you would think is, you know, just kind of more bread and butter stuff. I mean, the reality is it's not really like that. I mean, even in private practice, you just see the craziest stuff. And it's like, you know, crazy nerve stuff that I never really thought I would do. But, you know, and this is a great example, is actually like no one was doing nerve stuff in our private practice. And there was a private practice down the street that they were doing all the nerve stuff for the entire city of Atlanta, because nobody in my group wanted to do it, because nobody in my group had trained for it. And so they don't want to do it. And then I come in and say, no, stop sending it out to the other group. Like, I'll do it. I mean, I just spent some of my fellowship doing all this stuff, you know, so give it to me. And all that takes is an email out to, you know, your partners, and all of a sudden you're getting all these nerve referrals and peripheral nerve decompressions and nerve transfers. And that's only because I saw it at Washu, you know. I mean, if I didn't see it, then I would have walked in and been like, you know, hell no, I'm not doing a nerve transfer, you know. I mean, so all of that prepared me to kind of just be confident in my practice. And I think that made the world of difference in kind of my practice taking off my first 2 years. I mean, it all had to do with just being comfortable with everything, saying yes to everything, basically. I mean, anytime anybody asked me to do something, you know, I just said yes, but I felt comfortable saying yes because I just spent the past year doing all that stuff in fellowship. And I think once people realized that I was just kind of willing to take on, you know, whatever came into my clinic, that made a huge difference for me. And so it was just instrumental in kind of preparing me for practice.
So there's no question that Washu fellowship helped me more in 1 year than my residency did in 5 years, and that's nothing against my residency. It has everything to do with two factors. One, the breadth of things that I saw there. So the trauma combined with the bread and butter hand surgery combined with the microvascular surgery really kind of prepares you to take call as an attending. I was comfortable taking calls and attending, with the exception of taking general call, because you only do hand surgery for a year. And number two is the faculty from top to bottom are invested in your education, and as I mentioned earlier, really let you operate. And in addition to that, you know, manage your own patients in the Wool Clinic, but they're all also very available to provide pointers on how to manage those patients. Will be available if it's a particularly difficult procedure, if you want them involved. And perhaps what is also I haven't mentioned was learning from your co-fellows. So there's ample opportunity, and perhaps more now than when Dr. D and I were fellows, to operate with your co-fellow. And some of the most memorable experiences I had were operating with my co-fellow and learning from him, and to this day I still do. So I think that's one of the real strengths of the program, is having an alumni fellow, the alumni network of this fellowship, who you can lean on the rest of your career. So,
you know, after spending a year, you know, at Washu in fellowship, there was, you know, just going and being a young attending, there was no call case that I felt at all uncomfortable handling. I felt very comfortable handling things. Certainly not that I knew everything about, you know, there are cases I had to read up on and think a lot about. You're still learning, but, you know, especially we had so much experience, you know, dealing with trauma and emergent situations. We had, you know, such good mentorship. That part of it was really easy to transition to. And it's nice to be able to focus on building your practice and learning some of the logistics a little bit, and not having to focus on, oh, I didn't see this. You know, I felt like there was really nothing I didn't see.
The Washu Fellowship prepared me for the next stage in many ways. I had to stay in the city because my wife's fellowship, and Dr. Boyer helped coordinate interviews with me. My practice had to kind of take a different path than I expected, and they helped me first initially kind of build my more academic resume as I was going, and then kind of switch over to more of a community focus. out of necessity. And I think they, obviously you have the skills, you learn the procedures, you learn how to do the cases and things like that. But to have mentors who have been through a lot of stuff and who have worked, it's not, everyone is not just railroaded to one type of career the whole way through. A lot of these people worked elsewhere and kind of different type of things that they can kind of guide you as you see your career evolving.
I think to piggyback on that, my practice has taken a slightly more academic focus. I'm kind of in a community residency type practice where we're trying to grow it into a more academic vibe. And so the skills and the ability to perform research and educate residents and develop a program, an academic program that I saw at Washu to model off of was so helpful. So I thought that just the training on how to be an academician, how to talk, at conferences, how to develop a PowerPoint slideshow. I picked up on all of these, basic tasks and basic things, how to read literature appropriately and interpret it. Really, really all helpful from an academic standpoint. And from a leadership standpoint, I mean, you have the past president of the American Society for Surgery of the Hand. You have rising superstars throughout the entire residency. You have past presidents as well that are affiliated still with the resident or the fellowship. It just, kicking and screaming, you are dragged into leadership positions and into committees and things like that if you wanted, if you're, I don't mean to say kicking and screaming, I mean, if you want it, it's there for you. So I think it's just been, it's an untouchable program in terms of connections in that regard. And I've been fortunate to have been able to experience that.
Washu for me was, the clear number one on my list, for a number of reasons. But, I wanted a place that had a balance of bad trauma and elective cases, kind of had the full breadth of hand surgery. And I really didn't find that my experience was deficient in any respect. And as I start practice, even after taking a month off, I find comfort in the fact that everything that is coming through the door, I feel very comfortable making decisions about managing, because I've seen it and I've seen multiple ways to approach it. I think Jeff mentioned, starting practice, one of the harder things is getting used to all the administrative things. How do you run a clinic efficiently? How do you structure things? And how do you work with a nurse and an MA in your clinic? And, it's really a tribute to WashU that, the thing that's easy is the hand surgery part of it. So.
Obviously agree with everything that Steve just mentioned. And, I really chose WashU for all of the practice reasons that Steve just mentioned, but also just how well-rounded the faculty are within academics and leadership positions. Everyone is just so active in the Hand Society with their respective niches, if you will, and leaders in the field in each of those. And what really attracted me was to see that. And as I start, an academic career, that is, was something invaluable to see how people balance their time, working within the Hand Society and committees and what type of research, impactful research people are doing. It's really inspiring, and you just learn a lot how to structure that for an academic practice.
I think the breadth and the depth of the clinical experience is probably unparalleled. It's truly seen everything that could be considered hand surgery and probably a lot more. And the number one thing I've noticed in the years since I left is that I took so much from that fellowship year, and it is now who I am in the practice that I have. I literally quote somebody from WashU on a daily basis. it's hard for me. It's a part of the DNA of my practice, and just the experiences I had with each and every attending, the clinical experiences, they're a part of what I do now. So it's a part of me, and now it's a part of practice here in Iowa. So it is pretty cool when I reflect on that, how that experience in 1 year, you know, I recall so many specific events, things that were said, things I was shown, experiences I had that have shaped what I am. And that's just clinical practice. When it comes to leadership, it was modeled on a daily basis through the giants of hand surgery that are there, and the young faculty that are working their way through it as well. And certainly I've continued in academics or career, and just trying to do my best to even be close to the people that I worked with at Washu. So, you know, truly a wonderful exposure for me, and shaped my career so much. I feel like it's the thing that has made me who I am. I know that's a lot to say, but it's true. This is my last thing. When I was applying for fellowships, somebody that I trusted very much, Apurva Shah, told me that Washu was the best fellowship in the country, and that I should go there. And I agreed after finishing. And although I'm now part of my own fellowship, and I think our fellowship is very good as well, I think the Washu fellowship has a lot to offer and should be at the top of everybody's list.